Hey, this is Todd Bailey from Herbal Mana. Today, I have an opportunity to bring to you somebody pretty darn cool background, athletic background, medical background, uh, a lot of knowledge in sports injuries, not just treating them, but actually experiencing them, which is a little different. This is Dr. Rocky McCord, the second.
Hey, how's it going? Yeah, so basically, I now practice with my dad. Right when I got out of chiropractic school, I practiced down in South Florida for a while. We currently practice in Mobile and Baldwin County in Alabama. And yeah, he's been a chiropractor for 40 years. Um, yeah, he's treated injuries from auto accidents, sports injuries, stuff like that, naturally and very successfully. Over the years, he's kind of changed his paradigm on how to treat it. We're more fascially driven now and soft tissue therapies and stuff like that. And obviously, we use mobilization techniques and stuff as chiropractors. But yeah, growing up, he had a big clinic that did a lot of different things. But as I aged, I was an athlete and I played the travel baseball. I ended up going to Auburn, played there. My little brother played at Mississippi State.
Wow.
My sister was a cheerleader at Ole Miss. So we got them all spread out. My dad did anyway. And so with that required a lot of traveling from him. So he kind of had to reprogram his clinic and stuff like that to where we really just specialize in, instead of treating a lot of different things, we treat injuries, specifically acute injuries and accidents. So, but yeah, like we were saying, I grew up a baseball player, dedicated my whole life to it. Growing up, I mean, as an athlete, you're going to have injuries and stuff like that along the way. I went to Auburn, pitched there for a while, suffered a shoulder injury while I was there, went through all types of rehabs. And with injuries also comes, there's a mental side to sports as well. A lot of people don't realize that. And once you get up to higher levels, I played collegiately and played professionally for a little while. And, when you're throwing in front of thousands of people and stuff like that, and it becomes a job, you have to have a strong mental game as well. And so there's a mental aspect and mindset aspect that goes into that as well, which I think's helped me out a lot in business since I've been out. But fast forward a little bit, like I said, I went to Auburn, played there 4 years. I was drafted 3 different times. Once out of high school by, I was drafted by the Twins out of high school, turned it down to go to college. And while there, I got an exercise science degree. So I always knew, growing up, I was 100% going to be a baseball player. And then, I wanted something to fall back on. Didn't necessarily know it was going to be chiropractics at the time, but I knew I wanted to be in that realm because I grew up working in my dad's clinic and around injuries. And I knew I wanted to be in the natural healthcare industry. Just didn't know what I was going to do at that time because I was 100% focused on making it to the pros. So get drafted my junior year by the Royals, and came back again my senior year, and then finally went and played for the Orioles for about 2 years.
Nice.
Interleague baseball. Never made it all the way up to the big leagues because of injuries, for a lot of injuries. And with that, I got to go experience some of the best physical therapies, chiropractors, this, that, and the other for rehabbing these injuries. So that's kind of what led me to this. I went through and I worked with this PT who I think is one of the best PTs in the world. He's actually down here in our hometown. He taught me a lot about different fascial trains of the body and how to heal things by not just focusing on the area they're at, but how the whole body kind of works together. And this science, I believe it's called biotensegrity, meaning they get it off of a building science, but you use the body to kind of, judge where the injury is, basically. So, I mean, he just did some wild stuff to me. I remember when I was first going in there with these shoulders problems, and he's like digging in my feet and fixing all this fascia all the way up through my body to fix my shoulder. And, you're sitting in there like, man, what is this witch doctory that's going on here? I've never had this before, but, you leave out of there and you're feeling a lot better and you're healed. So I spent a little time mentoring under him. And, even my dad, he worked on him as well. And now we kind of use a lot of that to treat our patients and stuff here now.
Some of the treatment you received, you've integrated into your practice.
Oh, absolutely. Yeah. Like more like myofascial type release therapies and stuff like that. And trigger point therapies.
Do you ever have a patient say, what's fascia? What is this thing? Did you just make up this word, doc?
I have some, a lot of them, most of the time they don't really get into what it is and stuff. They're kind of just because it hurts a little bit to treat them. So, but they're more concerned with the result than what it is. But the ones who do, I explain to them it's just like a glue-like structure that goes over all your muscles and tendons and runs like a web through your body. And when this stuff gets stuck and sticky and it's not as elastic, it pulls on different muscles and tendons, and that reduces range of motion. And if you're looking at it like a building science, whereas like if we're going to build a big building and you have pillars, like bases at the bottom, say we're going to build a big skyscraper and it's going all the way up. If you have a loose piece or a weak piece down here at the base or anywhere along the chain, you're going to have compensations all the way up the chain that causes problems. So that's how we look at the body where, I could be in someone's hip flexor fixing their shoulder because there's fascia pulling the pelvis down, which is attached to rib heads, which are pulling on the shoulder girdle and causing reduced range of motion and weaknesses in that realm. So we really go into all those facets of what's causing a lack of function to the range of motion of the body, and then let the body heal itself. I mean, that's the theory behind chiropractic, essentially, that you remove interferences with the body and it'll heal itself.
It's kind of interesting to see that you're treating parts of the body far away from the real injury.
Right.
Too often, when we go to the chiropractor, we get our back adjusted, we go out. That's it.
Yeah, and I'm not saying I don't treat the spots locally, but I mean, when I have time, like I said, when I have times where it's just difficult with people, been other places, they can't figure out what's going on, I got to investigate down the chain.
That's really it. Diagnose all the way to the end, all the way down the chain, like you said. I found for me, it's important because I've had so many injuries and surgeries.
Right.
So I've made a real mess when I work with my chiropractor and my other professionals because I've had joint surgeries, knees, ankles, foot, back, shoulders.
Yeah, those surgeries are rough. So my little brother, actually, he's been through 4 or 5 surgeries. When you're an athlete, especially collegiately and stuff, you don't really have the opportunity to sit and wait on holistic care and stuff because you have to be back on the field if you want to play, if you want to get paid and things of that nature. So my little brother suffered a labrum surgery. He had to get a back surgery, and he fell when he was little. He's also like snapped his arm. I mean, I tell him, I'm like, man, you're like Frankenstein. He's got so many scars on him. And hey,
what kind of guy?
Yeah, he has to suffer consequences from it down the road, which is why, obviously we try to make sure people don't do surgery unless they absolutely need it. But sometimes it's required, and that's when things like what you guys produce come in handy for things, severe injuries and modulating pain and what have you.
I see on your website you do functional medicine. I've noticed some folks that just hang a shingle saying functional medicine. I know they haven't trained, but I know some of your background, and I know you put a lot of time and effort into it. So what is it? So our folks can understand what is functional medicine versus
let me explain how I got to
medicine.
that. Because this is really what I'm the most passionate about, and I'll tell you why here in a minute. But when I was 12 years old, I walked into a classroom one morning and just had severe stomach pain out of nowhere. Growing up, it happened like the next 3 days, and all of a sudden this just became chronic. I just dealt with it for years, about 12 to 15 years. We just thought it was like stress. When you're younger, I didn't know about functional medicine, all this stuff. Even my dad being in a chiropractor background and holistic background, we kind of just thought I had like a stressed out stomach and stuff like that, and I would just grow out of it. Never did, and eventually I went the allopathic route, and I went to traditional medicine. I went to the gastroenterologist. I ran this test, that test, the other, colonoscopies, this, that. Everything came back, said, there's nothing really wrong with me. There's kind of in my head. And for me, I'm a collegiate and professional athlete. I'm a pretty tough guy, and that just didn't really sit well for me. But over the years, that I ended up going to chiropractic school, and then I learned about functional medicine, which, if you guys don't know, it's root cause medicine, meaning they use special tests and they're looking to dig and find what is causing the problem versus like if you go to a doctor, they're going to give you an antibiotic. They're going to give you a medication, just something that's going to help alleviate a symptom, but it never really fixes the problem. I don't know of any pill that has ever fixed anything. It just kind of, alleviates symptoms, and then you hope the body can re-regulate itself. But I find typically you go into a doctor, let's just say you're tired, you're sluggish, you go in there, they're going to run a typical panel on you. Next thing you know, to them, they're going to say you have high cholesterol. And we know now that that was a big myth and a big lie. If you study the
Good
research.
moneymaker, though, for those statin drugs.
Right. Yeah, exactly. So you go in, cholesterol is at like 200, and they give you a statin to lower it. And what those statins do is they block certain enzymes in the liver that actually help a lot of different things, but they do lower your cholesterol. So by doing that, you have other energy problems. That's why sometimes will take CoQ10 and stuff with it. And so now you're on a statin. A few months later, you come back in. Now you have pain all over because statins do increase pain. So now you come in there, now you're on anti-inflammatories. Then you find out a lot of people are, because they haven't really looked at the root cause, which is diet and stuff like that. Now a lot of them are type 2. So now you're on insulin, and then the whole list goes on and on. These people are on one drug after another and never really got to the problem in the first place. So that's what I do now. Like I said, I ended up going to a functional medicine doctor, found out I had certain food sensitivities, parasites, other things that over the years I addressed. And, it's funny. When I first started out, I went the cheap route and I was trying to just tackle one little problem at a time. And you learn, I've spent thousands and thousands of dollars on myself, learning the hard way, what's right and what you should do. And even as a functional medicine doctor, I've even treated people in a certain way where I'm tackling like a functional medicine type symptom. Whereas now I've transitioned into more cellular healing, which I've found to really cure a lot of things. So we dive into things at a cellular level and detox at the cell. And it's been tremendous, not only for my health, but for all my patients' health now. And it's a process, and it's not like an overnight thing. But I've found that if you eliminate things that are impeding on the body's ability to heal, get bad stuff out, put good stuff in, things magically start happening. Your body just heals itself. And, you don't need a bunch of drugs the rest of your life. You can fix problems. And, we see it over here. Me, even when I was working with my mentor, when I got into functional medicine, we treated hundreds of patients. I've seen thousands of success stories. And, it's just amazing what can happen when you eliminate what's causing your problem. But, you got to find, you got to dig.
Dig.
My mentor used to say, hey, if you're riding down the road and your check engine light comes on, are you just going to put a piece of tape over it and keep driving? It's like, no, you're going to go to a mechanic, look under the hood, find out what's wrong, and fix it. And that's what we do as functional medicine doctors. We dig up under the hood. We're looking at gut dysfunction. So I'm looking at food sensitivities. I'm looking at toxicities, so certain toxins. We're looking at mineral imbalances, things that go on that create these reactions in your body. You have to have certain reactions to create energy in the body. And if you don't have the right type of gasoline for your car to work, it's not going to function properly. So we look at things at a cellular level and treat the cell. And then once the cell gets healthy, everything else in the body kind of takes care of itself. So hormone starts to regulate properly. No more brain fog, no more gut dysfunction, no more blood sugar dysregulation. So up and down. So type 2 diabetes is one things we treat here as well. And we get great results with it.
Got a lot of buddies that are traditional MDs, and they're a little frustrated with practice because their protocols are dictated to them. And I tease them a little, and they agree with this. I tell them they've got the 4 Ps of practice: poke, prod, prescribe, and push them out the door, because you have to get on to the next patient.
Right. Yeah. It's a speed thing. They only get like 15 minutes to deal with the patient. My uncle is a very successful urologist, and they'll tell you, if you go talk to doctors, and we're the same way, just in a different way, meaning you have a toolbook of things that you know to do, like a doctor. Most of their stuff is, they have no training in nutrition at all. So most of their stuff is, hey, you're going to come in, and I'll be the first to tell you, if it's an emergency, I think doctors are great. Like I said, I'm a functional medicine doctor, and I think going to doctors are great. But it's like you said, they're so regulated on what they can do, which is why when MDs try to come over to, be functional medicine practitioners and stuff, it's hard for them. That's why I think chiropractic is one of the best professions to get into functional medicine, because we're so holistically minded. So our board's not going to really attack us for stuff like this as much as MDs. They try to switch over to do what we're doing. Their governing bodies comes down on them pretty hard.
I've actually seen that. I saw that recently in Phoenix, Arizona. An MD tried to do the functional medicine, ended up having to set up 2 separate practices. He had an MD practice across the parking lot, a functional medicine practice, could not work together. Yeah. Yeah. Just
Wow.
odd as can be, because really we're all wanting wellness, and it's the
Right.
functional medicine that'll get us to the root of the issue. Like you're saying, do the research, do the hard work to find out what the problem is so we can be well, not just not sick.
Right. That's what every doctor kind of got into it for, is like they wanted to help people. And
Right.
that's really why, we're integrating more functional medicine in our practice now. It's like, although we're healing these people as far as their injuries go, we're helping them big time. But everyone I see in here is sick. They all have. I look at their symptoms. It's like type 2 diabetes, high, cholesterol, blood pressure issues, this, that, and the other. So for me, it's like, man, if I really want to help someone, we got to get into more of a healthy lifestyle. It's not just come in here for temporary fixes. We got to get you healthy. And I mean, there's a big push going on in government right now with Robert Kennedy Jr. and some of those other folks that are really want to get rid of chronic illness. That's what we're all in it for, is like, hey, man, we are being poisoned out there at a high level. You have
It's kind of funny. He's looked at as a bit of a radical, but he's just saying common sense things. It's funny to watch the reaction.
Yeah, I mean,
Just he's saying things that make
he's been
sense
fighting
from
against
the.
environmental toxins and stuff for
Mhm.
20-something odd years. And he's right. I mean, if you care about your children and stuff, we're being polluted at a high level. And I mean, you just watch now, it's coming out in the news, things like certain cereals and other foods, they're banned out of other countries, but yet we still allow them here. There's certain carcinogens in them. They're toxic, and they lead to chronic illness. And we know that, and, still allowing it to happen. So, you got to kind of look outside the box when it comes to health. Like, hey, man, you're either putting things in you that are making you sick, or you're doing things that are going to make you well. So you got to take on a full lifestyle if you want to live a long life and live a healthy life. Meaning, I'm not saying you can't be unhealthy and live long, but there's a difference between well-being and like, what's the other term I'm looking for? Like living long versus living well. Meaning, like, hey, yeah, you can live well
Hopefully
in
can do
your 80s.
both.
He's very healthy, good brain function, good energy, not bogged down. That's the big thing I see people for now. They're just tired all the time. They don't feel good. And the reason being is metabolically, like 90% of America is metabolically unhealthy. And it's because of the toxins, the food we're eating, the environment that we're breathing in, the water we're drinking. So all that goes into healing the body. And once you do, I mean, it's funny how people are like, man, I feel so good. I'm like, dude, you just feel normal now. We've just been sick for so long.
Yeah, the American diet, the super processed foods, the fast food, it's not good. In
No,
fact,
it's
most
not.
people
And the
in the
thing is,
grocery
it's
store.
funny. A lot of people tell, man, well, I used to, my grandfolks did this and that. And I tell people all the time, like, man, the food is not the same as it was 20 years ago. The soil is not the same, which is why supplementing, you know, I, I, I don't like to put people on a lot of supplements and stuff, but there are some that you have to have. People are
It's
just
hard to get through
depleted
a
in certain
diet.
minerals and vitamins now. It's like, hey, if you want your engine to function well, you got to put the right stuff in it. And you're just not going to get it. I don't care how much vegetables you eat.
Yep. I did a little experiment last winter. I bought some tomatoes from the store, put them on the counter. In the winter, they're grown in a greenhouse, and they're bred to not have high enzyme content because the enzyme breaks down the tomato,
Yeah.
among other things.
Uh-huh.
6 weeks. After 6 weeks, I just threw them away. They hadn't changed. They sat on the counter for 6 weeks and weren't breaking down. A good tomato from the garden will break down in under 6 days, more like 3 days once it's
Right.
really ripe, because it has all the enzymes working away in the tomato.
Yeah.
But in our supermarkets, that food chain, we have bred a lot of the
Preservatives.
content out.
Oh
A
yeah,
lot of
there's
this.
tons of stuff to try to keep this, and it's all this. I mean, it's really how you make money. We can dive into all the things that changed in the mid 1900s to get us along this path of what's going on. But essentially, man, you just kind of got to wake up to the fact that food chemists put things in food to make you want more, and and then they essentially make you sick. You go to the doctor, and then you're going to get prescription medicine. And I'm not saying that all prescription medicine is bad. I'm just saying, hey, I believe it should be used to help you get out of a symptom temporarily, and then you need to look to a natural route to heal your body.
Yeah,
you don't
so
want
the
to be taking this stuff.
situation.
That's how we can all medical professionals can kind of work together in this. Whereas, like I said, I have tons of friends that are medical doctors, like surgeons and stuff, and they're fantastic. I would recommend them to anybody and stuff. I just, it's like you said, it'd be nice, like, hey, if we all kind of working together, like, hey, let me fix this problem, get you over to someone who can now fix your health internally and then make you more healthier down the road to prevent from coming. Because like I say, you just keep on getting on drugs and stuff and chemicals, it's just going to add up. You're going to need more and more and more to help sustain you.
Yeah, without ever really being truly well.
Exactly.
I assume you work on some athletes. You get the opportunity to work on injured folks. How does your background affect the way that you treat some of your injured patients, especially athletes, young athletes that you're working with?
Athletes, typically, I'm going to be honest with you, just because I'm in baseball, when it comes to athletes, I pretty much just see a lot of baseball players and stuff like that. So I guess my background helps in that manner because I've been all types of different other PTs and other things that didn't really work for me in the past. So now I treat them in a specific way. Like I said, addressing kind of root cause in the fascia, like we were talking about earlier, that was causing injury. And our goal, like I said, that we do when we treat, I mean, most of the time, if it's an acute injury, you're coming in, the body's going to heal in 4 phases. And just getting you through, usually like phase 3, the body could take up to like 2 years to fully heal. But I want to make sure that scar is formed in a manner that it's more elastic, so you don't form scar tissue. So a lot of people don't realize scar tissue is a very, very powerful and bad thing, and it leads to all types of problems down the road. And I mean, I believe it's one of the root causes of chronic pain and stuff that a lot of people didn't realize. You know, some people sprain their ankle, they get in a minor fender bender, they think it's minor, and it doesn't take much G forces to tear tissue. And when tissue gets torn, the body's going to heal itself in a certain manner. But if it doesn't heal itself and form a collagen, a fiber that it once was, it was like netted like this, and it had full range of motion, it could stretch. But when it heals back up, it shortens and it heals in this scar tissue formation. And you just got to think, I mean, you have nerves, arteries, and veins that run through just about every innervation of the body. And if it's going through a bundled area, things could possibly be more hypersensitive down the road. You could have less blood flow to the area, and now you got chronic pain there the rest of your life. It's
like you're reading my chart.
Yeah.
I've had a lot of surgeries over the years, 20 orthopedic surgeries, and I can tell you in the early years they weren't that concerned about the scarring. And I've got big scars. I've got knee scars that long. I've got a shoulder scar 6 inches long. And they weren't careful back in the day. Of course, we didn't have good imaging either. Right. So they would just cut away until they could find the problem, sew it all together as best they could without regard to the scarring. Now, these days, surgeons are much more in tune.
Right. Oh, they're great. The technology's great. But like I said, the surgeries to me are not that big of a deal. Like I think surgeons are great. And, they do a good job. It's the post-surgery care that you got to focus on, because the scar is going to heal in a certain way. And you want that healing to be as elastic as possible. And that's where, you really want some hands-on training, like not just going into a PT and doing strength exercises. You need someone to get their hands on that tissue and stretch it and length it out.
That's the later years of surgery, more of that. Even the doctor coaches, the main doctor that I use, coaches me on how to stretch the tissue, how to get it to form properly. So between PT sessions,
a lot of people are doing this. I'm not saying that I'm just specifically
not enough people.
Yeah,
and certainly not back in the day.
No, it was a lot different back then. But it's like you said, they didn't have the science to know back then. Now, I mean, they're finding all different things where it's like, different scar tissue things are causing all types of problems. I mean, you see it all the time. Like different women get these C-sections or other surgeries, and down the road they're having these back problems in certain things, and or like even shoulder issues. I get down and dive deeper into history and find out that they've had some type of C-section or other surgery or a pelvic floor issue, and it's leading to problems because that scar tissue formed. It's shortened tissue, and you got to understand what happens during the second phase of healing with injuries is these glues, they come in and they attach. You say you've torn some tissue, okay? These glues are going to attach to the sides, and its job is to bring it back to a neutral state. But they don't just fill in like little, what's it, Tetris? What's that game? Tetris. So they don't fill in like little Tetris boards. It's not like perfectly filled in. they grab everything. I mean, they grab everything and they just shorten everything. So now when it brings that tissue back to its normal state, it's now pulling on other tissues. So now you have reduced range of motion here. So what's the body got to do? It's got to compensate somewhere else to fill in that range of motion that's missing. And that's where it's like, hey, man, it's like a Jenga board. The body all the way up the chain could get messed up from that one little issue. So,
yeah, I have to get body work every couple of weeks or so just to work on the old scar tissues because of that accumulation of trauma.
mm-hmm. Yeah, and there's new therapies coming out that are help to deal with scar tissue and stuff. But essentially, I mean, really, once bad scar tissue forms, you kind of got to, sometimes you got to go in there and get it surgically removed, get it cleaned up. But, you know, and that's what we try to prevent here. Like I said, we treat a lot of auto accidents and injuries of that nature. And our goal is pain modulation's a big thing, but it's really function of that tissue. Just because, you know, we've seen so many people get injured and they come in 2 to 3 years later and now it's pretty much kind of permanent. And now they're on kind of like pain management with someone like us. And we don't want to see that. Because if you can address it early, a lot of times you won't have the problems down the road. So that's our goal. We put them through a series of treatment for a few weeks. And then once they're strong, the tissue's stable, we send them out the door. And it's just maintenance work from then on out.
Approach to like that. You mentioned before we started the video that your father, whom you practice with, does a bit with DMSO.
Yes, he did. So growing up, like I said, I had a bunch of injuries, and my dad used to always, because he was always into some radical different stuff, and he had this stuff called DMSO, which is a product that you guys sell, correct?
Correct.
In your products, and I don't know all the science behind it. I just know he was telling me that, you know, they used it on horses to kind of help with pain, and what it does, it drives deep into the tissue, from my knowledge of it, and it helps modulate pain and heal things. I mean, my dad does some pretty radical stuff with, you know, he would if he had a sinus infection, he would snort that stuff. And
awesome.
I don't know how he did it now, because I'm gonna be honest, the DMSO is a very powerful treatment. So when you put it on you, it initially burns a little bit, then it itches, and then all of a sudden you start to feel better. But I remember I would be injured, like my arm would hurt and stuff like that, and we would mix that into other treatments like, you know, BioFreeze or something like that, because what it did, it would take that stuff and drive it deep into the cells. And that was really what helped with pain. So, I mean, like I said, you know more about that. I'd love to hear a little bit about what it actually does. This is just my basic knowledge on it. But yeah, my dad used it. It was funny. He, like I said, I used to play travel ball up and down the road. And me and my little brother played on a team from Memphis. And one of the guys on my little brother's team, his dad, he played like collegiate football at Ole Miss. And my dad was bringing up like DMSO for an injury. And this guy, he had put some on his knee or his leg or something like that and compressed it, you know, like wrapped it up for the night.
Oh boy.
Which you do not want to do. Okay. But when my dad was telling him, like, because this was back in college years ago, I mean, 20, 30 years ago, I guess they would use it on, or some people who knew about it would use it on athletes. And he like wrapped it up around the injury. And the next day, I mean, he had like burns on his leg and all types of stuff. But, and he was just like astounded at my dad snorting this stuff. Because he was like, man, he said that like killed me when I did that. But
the worst thing is that it attracts water. It'll bond with water molecules. So if you rub some on your skin, it's going to start grabbing water molecules, and you're going to get a little irritation. It's going to feel like a really intense patch of dry skin. You even get a little red and irritated because it's grabbing water molecules as it starts churning its way through the tissue, diving through the skin and on in. And if you put it on 100% undiluted, wrap it up, it's going to be grabbing all kinds of stuff. You just don't want that. You want it to breathe. And it is magic. It's great.
It's
inflammation.
It's a miracle. Like I said, I've had tons of different doctors use it on me, and in the past, like old school type doctors and stuff. Because, you know, some of these products are, you know, in your industry, like FDA, as far as regulating things and doing things, it seems like everything that helps, they come down hard on as far as regulations go. But like I said, I've personally used it myself, and I can tell you guys, I mean, it's amazing. For pain and other, like I said, my dad swears by it for even sinus and sore throat issues. I mean, just because for him, it's just helped everything. So he's just like, man, I'm going to try to use it in every type of fashion you can. And like I said, he's radical with it, but it's worked for him.
My kind of guy. Well, it does work well. It's just a natural substance. It comes from trees. It's the byproduct, the pulping. It's part of the cell wall, the lignin in the cell walls. and it works well. Great anti-inflammatory, great for pain. It's also a vasodilator. So if you have an injury, you want to be able to pull the garbage out of the injured site and get nutrients into the site so you can promote healing. It's just a good thing to have in your natural medicine cabinet. And we use it in all of our products. In fact, we've got this one I was just using earlier today. It's a frankincense DMSO gel that we use. And we've got a whole bunch of different products like this.
I'd love
to
check some of your stuff out.
I will definitely ship some to you. Absolutely.
Yeah, but like I said, I mean, since I was probably 12 to about 25, I was playing sports day in, day out. I mean, year-round baseball and stuff. So when you do, I mean, your joints are getting taxed and you're going to have pain. But, you know, things that I know now as a functional medicine doctor, I wish I would have known back then as an athlete. You know, I was eating terrible. I wasn't sleeping well. You know, I'm out drinking other stuff and things you shouldn't be as an athlete, but you know, you live and you learn. But now, like, I mean, I tell people all the time, I'm about to be 32 here in a few weeks, and I feel better than I've ever felt in my life. Awesome. And I can perform a lot better than I ever have it. But, you know, having these natural means to modulate pain as an athlete is just, it's nice because most athletes are chewing up ibuprofen every day just to be able to play. And there are things out there, like things you've created and other natural things that can help you and not damage your gut microbiome, not damage your health, and not cause permanent damage later on that you don't need. So, I mean, it's just nice that you guys are creating things that are going to be helpful to athletes like myself and other people I treat.
Back in the day when I had my injuries, I would take as much ibuprofen as I could take until I would bleed internally.
I took 800 milligrams a day, and then on days I pitched, I'd take 1,600. I couldn't play without it.
And then once I got damaged, I'd be passing blood, I would switch to something else. I'd get one of my doctor buddies to get me some Celebrex or something like that. Or I'll leave.
I was the same way.
Keep switching and damaging because I didn't have some of these natural substances, and I certainly didn't have the coaching like you can provide to a patient. Right. It just wasn't available back then.
Right now, I mean, I'm currently trying to, I'm working on a new course and stuff. It's going to take me a few months to get it created, but I want to create this off-season detox diet specifically for like college and professional athletes. And what it's for is really, is when you're performing and during the season, you have to, like I said, I understand this just because I did it. You are taking things like your Celebrex and these dose packages sometimes just to be able to perform that week. And it's damaging to the body. But like I said, if you can, in the off season, get with someone like me, a functional medicine doctor, I'm going to create a cellular detox for these people to really go in and do a whole house cleanup of the body. Okay. Like I said, they're using this stuff year round. You don't need it in the off season. Like I said, especially those natural things even work in season. But if I can, get a hold of these athletes in the off season and teach them detox strategies to go in and clean up the cell, clean up their immune system, because all that stuff, like I said, it's damaging to the gut. And we know 70% of the immune system is derived in the gut. If we can go in and clean up that, clean up their inflammation, clean up their sleep, it's going to lead to less injuries the following year. So that's something
even weekend warriors could use.
What's that?
Sounds like something even weekend warriors could use, regular folks could use besides these top level athletes.
Yeah. Oh, I mean, that's what I treat. I'm treating a lot of people for that. And I mean, that's what I do now. I do a cellular detox program anywhere between 3 to 6 months. My main treatment's 6 months. It's a phased treatment. First, you're going in and doing drainage and cleanup because you can't detox until the body's ready to detox. So we're cleaning out the liver, the gallbladder, the kidneys, just preparing the body to get stuff out of the body once we want to start binding things. And then the second month, we're going into the gut. The gut's really very important, so we address it early. So we're going in and doing cleanup of parasites and stuff like that in the gut, things that are causing a global issue. Like I said earlier, when I was first addressing things, I would, go treat this leaky gut, treat this problem, treat this thyroid, and got great results. But I've learned ultimately, man, if you can go more upstream, get the heavy metals out, the parasites, the glyphosate, all these chemical things that we're bombarded with, get it out of the body, then treating those things on the other certain issues on the back end, it lasts and it's permanent. You're not coming back and having these issues down the road again. So it's a cellular-based treatment.
When you work with patients doing this detox, do they need to come into the office, or is this something that can be done remotely?
No, so some of my local ones come in just because they're old school and they want to come in and talk, but I do it all remotely. So, I mean, you don't have to
This
be,
is
I treat
fascinating
people in
because we've
different
got a
states.
lot of our clientele all over the U.S. and other countries
Mhm.
that could benefit from this serious approach to really cleaning up.
Absolutely. I mean, you see people like Dan Pompa, others. I mean, a lot of people now, 'cause we know that fixing the cell is what you have to do to get well. So it's cellular derived, it's cellular healing. In the cell, you have a mitochondria system that creates energy for you. And around the cell, there's cellular receptor sites. So if you testosterone and insulin, things that are going into the cell, they have to come into that receptor site and be allowed into the cell. And because of how we live our lifestyle now, the cellular receptor sites, the cell's actually damaged on the outside. So now there's less receptors. Okay. So this is typical you see with type 2 diabetes. With type 1, you don't make enough insulin. Okay. You can't create it. With type 2, you have plenty of insulin. Okay. Your cell's damaged and it's, the insulin's yelling at a cell that can't hear it. So you got to fix that cell to now get more receptor sites open that when the insulin wants to come in, it can attach to the cell and then it can get into the cell. Okay, that's why cell health is so important. In the cell, you have waste products. If it's working properly, you have a nucleus in there. It's doing gene expression. So now like the cancers and genetic problems are getting caused by inflammation inside the cell. So like I said, you have to address things at a cellular level, and what causes cellular damage ultimately are, we're finding out that it's toxins. So that's why detoxification is essential these days. There's too many toxins coming in. So if you're not doing things, I mean, daily to get toxins out, you're gonna eventually, your bucket's just gonna get overfilled, and then eventually you're sick.
Somebody wants to work with you, but they live in California. How do they connect to your practice for something like?
Just reach out to me. My email address, I'll give you my personal one. It's dr.rocky@themccordclinic.com, or you can just go to themccordclinic.com and reach out that way. I'm currently in the process. I had a bunch of other ways to reach me, but I'm currently rebuilding some modules and stuff right now. So I had web pages too, but they're down right now. So the best way to reach me is go to themccordclinic.com and go to the contact page, or if you want to reach me personally, just go to dr.rocky, ROCKY, @themccordclinic.com. And then,
Awesome.
just email me and I'll reach out with you and we can set up a discovery call and, get to whatever the root cause of your issue is.
One of the problems we run into with our customers is they'll use our product and we think our product's awesome, but you can't get lasting relief unless you're treating inside problems as well as the outside problems. So we can put the DMSO based products on, the good products, good relief.
Mm-hmm.
But if we don't have good cellular function, if our diet
100%.
is creating a lot of inflammation, if we don't hydrate, if we don't sleep, we're not going to get that level of wellness that's possible.
You're not going to get 100% well until you do.
Agreed.
You got to live the lifestyle, really. And I'm not saying teetotaler. I'm kind of more on the 80-20, but if you're sick, you got to go strict for a while until you get healed. And then,
you can't be the cause of your own problems. You can't be fueling your own inflammation and expect to feel truly well.
Right. Yeah. Like I said, we're modulating pain and inflammation in our office using external things. But, down the road, like I said, if you have chronic inflammation and stuff like that, it's internal inflammation. It's what you're putting in your body. So if you want that fixed, like arthritic problems and stuff like that, autoimmune things, you got to go in there and do a deep cellular cleanup.
Do the hard work, the deep work. We get a lot of great client customer reviews. They're kind of interesting, awesome reviews for people that actually use the product for a while.
Sure.
But at least once a month, we get a review that says, I tried it last night. I still hurt this morning. It's not good. 1 star.
Yeah, there's a lot of people that think
application.
it's like a magic overnight pill. Hey, I'm not going to lie to you. Sometimes people get results, I'm sure, with your stuff overnight. But,
if you want it to last, you've got to do the deep work.
Right. I try to tell people this all the time. If you're going to go like build muscle in a gym, you're not just going to go one workout and build muscle. Just like you getting sick wasn't just one occasion of things. This is accumulation of stuff you have done over the years. So, it's not just one quick. And it would be nice, if they made some type of pill that just automatically made you healthy. And maybe down the road they'll have something like that. But as of right now, they don't make it. You have to put
not
the
even on the horizon yet, but that would be awesome. All right. Well, I think this is great. I love your approach. Really love your approach.
Well, I've enjoyed getting to talk to you guys, and I can't wait to try out some of your products.
Make sure you get
I
plenty
said
of products.
I'm an avid golfer.
Father.
I still stay active and do a lot of stuff, and like I said, people just got to realize with an active lifestyle that you are going to have some pain. Acute stress is great for the body. That's how it adapts. It's just things that become chronic. That's when you have a problem. Meaning, like if I was going to go to the gym and I want to build a muscle, you have to tear it down. So of course you're going to have some muscle soreness and stuff like that. You're breaking the muscle apart to rebuild it, to build up more muscle. Okay. So being active and doing things and having a little pain is great for the body. And it's nice to have things like what you're talking about, DMSO in your products, to help modulate that pain while you're doing things that are actually boosting your body's ability to adapt and live long.
I agree. All right. Awesome. Well, I appreciate your time. This is fantastic. I think we may have to do a follow-up because I've got a lot more questions, and what you guys are doing is great. I didn't want to get your dad on one of these times to quiz the old guy.
Oh yeah. He would, you guys would love him. Like I said, he's 40 years in this profession, done a lot of different things, with how he like built this business and stuff. And other things like as far as natural healthcare stuff as well, things that were pretty radical and different fasting elements, which are things I do with some of my coaching. But he's done some pretty radical stuff, and he's a funny guy to talk to. He's definitely
fantastic. Well, I look forward to doing that too. All right, we appreciate your time.
Absolutely. Oh yeah, and hey guys, I am on Instagram dr.rockydc.
dr.rockydc. Perfect. Yeah, and that's your Instagram handle.
And it's chiropractor. Yeah.
Okay. Fantastic.
I've enjoyed it, guys.
Right, thanks again.